What should be used to treat vulvar lichen sclerosis? Topical corticosteroids. Patients with cutaneous cryptococcus most likely have HIV infection. This is known. Now, what do you expect their CD4 count to be if they have cutaneous cryptococcus? Less than 100 millimeters cubed. In order to confirm cutaneous cryptococcus, biopsy of the lesion should be obtained, obviously. It's the gold standard, right? In general, what age should colonoscopy screening begin? At the age of 50. Placental detachment from the uterus before delivery is called what? Abruptio placentae. In general, how do you treat acute decompensated heart failure? With diuretics and/or IV vasodilators. And what does that do? It reduces the preload. A child with bilateral conjunctival erythema with watery discharge should be treated for what? For measles, yep. Note that complementary medicine in children is fine as long as that does not interfere with known medical treatment, right? So take their actual medicine. I'm going to say some hazard ratios and you tell me the effect. So a hazard ratio less than or equal to 1, or I should say less than 1, is a protective effect. And if it is equal to 1, what's that? No effect. And greater than 1 is a detrimental effect. What is the worst prognosis for a spinal cord tumor? Like what sign would you see? Lower extremity hyperreflexia. Yep, that's bad news. Management of hydatiform mole and is a suction curettage. And then what serum finding should be checked? Beta HCG levels. Management of heart failure is best managed according to what guidelines? The New York Health Association, right, or New York Heart Association, whatever. NYHA. Children with Turner syndrome should get what sort of imaging? An echocardiogram, right? The strongest predictors of stent thrombosis after coronary stent replacement is a premature discontinuation of what? Of dual antiplatelet therapy. Patients with adenomas found on the colonoscopy should be followed up in less than 10 years. And here's the key. If it's a 1 to 2 TAs, that's 5-year follow-up. If there's 3 to 10 and they're greater than 1 centimeter, that's high-grade dysplasia, that should be 3 years. If there's more than 10 TAs or adenomas found, follow up at 3 years. And if there's an obvious issue, like something way worse than that, follow them up every like 3 to 6 months for the most part. A mother with a history of peripartum cardiomyopathy is at risk of a heart issue and death if she delivers again. So you need to stratify the risk with what imaging modality? With a transthoracic echocardiogram. Patients with hypertrophic cardiomyopathy should get an implantable cardioverter defibrillator. Improved glycemic control may help decrease swelling of the optic disc. Okay, we know that. What sort of supplementation that is a common thing, especially with people concerned with their bones, hint, hint, may lead to decreased absorption of thyroxine? That would be calcium, right? What sort of proliferation and growth of a benign lesion at like birth or a young baby for the most part, it will grow and shrink and is normal. It's an infantile hemangioma, and that's a benign condition. Note that high-risk patients should get prophylaxis with antibiotics to prevent endocarditis. A patient with a localized herpetic zoster should get what medication that starts with a V? Valacyclovir. Hospitalized patients with herpes zoster that is disseminated should be placed on what sort of precautions? Airborne precautions. Patients with small bowel obstructions should be admitted to the hospital and started on what sort of management? Conservative management. All right, so you have an elderly patient with with a macular degeneration. What should they be screened for? They should be screened for severity, especially prior to any sort of cataract surgery. So don't get tripped up on that. Now, the management of diabetes mellitus type 1 in general is what? A long-acting basal insulin and mealtime boluses of a short-acting insulin, right? It's very straightforward. If you're on your neurology service and a patient comes in diagnosed with subarachnoid hemorrhage, what sort of imaging do you want to get? A non-contrast head CT initially, yep. And if you get a lumbar puncture, what do you want to check for? Xanthochromia, right? So iris is a transient worsening of HIV symptoms prior to getting better on an HIV medication. What does iris stand for? Immune reconstitution inflammatory syndrome. Is it ethical to date your patients? Nope. Is it ethical to date former patients? Guess not. True or false? Ideal kidney donors are related to the patient that needs the donation with an identical blood type. That is definitely true. Note, you're going to need to know how to manage DKA 100% effectively. So if you don't know how to manage it, just remember this. Start with an IV insulin, an aggressive fluid support, potassium supplementation, and if the patient's glucose falls below 200 milligrams per deciliter, you will, but the anion gap still exists, you have the IV insulin and add dextrose IV fluids to prevent hypoglycemia. So keep that in mind. Note that for management of DKA, you'll eventually discontinue the IV insulin infusion. For anti-thyroid medications in pregnancy, you have your first trimester, you'll give what? Propylthiouracil. And then in the third and second trimester, you can start giving like methimazole. If you're at your gyne clinic and you see a lesion on the cervix of a female, what do you want to do? Like you see an obvious lesion, right? You do the punch biopsy. For necrotic wounds, one of the most important things is to do what? Debride the wound. How do you basically treat major depressive disorder? Just two broad categories. Both start with a P. Pharmacotherapy and psychotherapy. That's good to treat major depressive disorder. The most important factor for determining the prognosis of patients with COPD is what? Is an FEV1. Patients with non-allergic rhinitis should be treated with what? With intranasal glucocorticoids. Patients with non-allergic rhinitis should be treated with intranasal glucocorticoids. Fatigue and pallor after syncope indicates neurocardiogenic cause. Is that true or false? That's true. Fatigue and pallor after a syncope indicates neurocardiogenic cause. And just note that newborn males and females often experience neonatal breast hypertrophy. It's nothing to worry about.